In today's Health Watch, June is Cataract Awareness Month. It is a common eye disease affecting an estimated 20 million Americans. Most cataracts develop slowly, but as the disease progresses, it can affect your vision. Joining us now is Dr. Christopher Starr. He is also an associate professor of ophthalmology at Weill Cornell Medicine. Good morning, Dr. Starr.
Good morning. Thank you.
So right before we started this, I said to Vlad, is cataract the one where you have the rim around your eyes? I clearly know nothing about this. It's the one where your lens is cloudy, Vlad explained. Is that right?
Yeah. This is why we have Cataract Awareness Month, because there is a lot of misconceptions about it. Think of the eye as a camera, and the lens, you think of the lens of the camera, over time, it gets cloudier, less translucent. And that's what a cataract is. And usually the process of that starts when we're 40. This is why people start needing reading glasses.
Dr. Starr, I just turned 40.
Reading glasses, right
here.
There they are.
Okay.
I need them.
You should actually put these on to see if they work. Because if they do...
I have contacts.
They will. They will.
Ooh, but this...
It makes everything a little bit bigger and clearer, yeah. Well, for out there, it's going to be blurry, but if you look at the page...
This is clear.
Yeah. Believe it or not, it's called presbyopia when we're 40, but it's the same process that ultimately becomes cataracts. The lens starts getting stiffer, and then it gets cloudier, and usually around age 70 is when cataracts are visually significant, and that's usually when people have cataract surgery.
So the cataract surgery that you're talking about is pretty remarkable. They're actually able to replace the lens of the eye with another lens that's artificial.
That is correct.
And so what should people do? I know.
It's one of the few things that we cure. You know, there are a lot of eye conditions, glaucoma, macular degeneration, things that we can control, but we can't cure them. But cataracts, once they're gone, they never come back.
So what can you do? Is there anything you can do, because you can't stop aging, to prevent getting cataracts?
So you can't truly, we always say if you live long enough, eventually you're going to need cataract surgery. But things like protecting your eyes from the sun can probably reduce the risk of cataracts happening earlier. Smoking. Smoking is bad, obviously, for everybody, for the entire body, but also can cause cataracts to develop. Some diabetes and other medical conditions can cause cataracts a little earlier. Steroid use, the overuse of topical steroid drops can cause cataracts to progress.
What are steroid drops? Are like,
sometimes
like
we use steroid drops.
Eye-clearing drops?
Yeah,
those?
well, the get the red out drops are different. Steroids we usually use for inflammation, and it's a prescription medication.
So what are the signs that might indicate that cataracts is coming?
Blurrier vision, cloudier vision, it usually progresses very slowly. Sometimes we don't even realize it's kind of happening. Glare, sensitivity to light, loss of contrast, black letters looking a little grayer, loss of saturation of colors.
It'll
things like
affect
that.
color?
Yeah, it kind of just imagine, the lens of a camera getting kind of dirty or cloudy. Everything will be kind of washed out.
But doctor, before you go, I mean, all those symptoms that we showed, I have them, but when I recently got my eyes checked, I don't have cataracts.
You don't have cataracts.
So you're right. So how do you tell the difference between
usually with cataracts, glasses, if you get your eyeglass prescription tweaked and optimized, usually that will correct astigmatism, nearsightedness, farsightedness. When there are cataracts, usually the glasses don't fully correct it. So that's the difference.
Very good to know. All right. Now, look at Adriana. She's like, I learned a lot today.
I did. I love this show.
Our audience. That's what we do. Dr. Christopher Starr, thank you very much.